Dr. Kahng, what do you have to say about bleaching teeth? I know, well, I think there is 3 different kind of major ways of bleaching or whitening a tooth. One is you go to the pharmacy and you buy a generic tray, put it on at home, and for many, many nights, and eventually you might have white teeth. And there are many of those things out there, many different versions. Then there is a version of a bleaching tray in the office, but custom made and by a dentist and more expensive. And then there is a thing, kind of laser bleaching or Zoom bleaching or whatever it's called, where within a couple hours or so, boom, you're in the dental office, you're out, and your teeth are white. I don't know whether there's another version, but tell us about all 3 versions, the pros and the cons, will you please?
Okay, you can use the over-the-counter bleaching agent, but that it takes time, it works, but the result is not that much satisfying. And the other one is we call it a custom tray tooth whitening. And you can go to the dentist, they can take the impression, they make the mold, and they make a custom tray, and then you can use the bleaching gel with the custom tray. That one is pretty much effective way to bleaching the teeth. But it takes time. It usually takes about 2 weeks or 3 weeks, and you have to use the custom tray at least 3-4 hours at home. And another way is using the in-office tooth whitening. You can use the Zoom Light or some other brand. There are many brand names, and they're using the light and they're using the bleaching gel on the tooth, and it takes about 1 hour. You can have a whitening teeth. But the Zoom whitening or the in-office whitening, most whitening the gel material is hydrogen peroxide, and it's more stronger agent they're using, and mostly the result is the same, but the in-office tooth whitening using the stronger gel, and patient they said more tooth sensitivity. But the custom tray whitening, usually they use a little milder one, so less sensitivity. So one another, there's some con and pro. So it depends on the patient which one is a better choice. So mostly we suggest using the custom tray whitening or in-office whitening with a light. Both of them is pretty much same result you can get.
Okay. Well, let me ask you a few questions. Let me summarize this a little bit. So the reason the over-the-counter bleaching takes longer because the stuff you put in it, which bleaches the teeth, is not so strong. Is that right?
That's right.
And the reason it is not so strong is also those trays, I guess, they're not custom made, so that bleaching stuff sometimes, you need to, it comes easier out, so it cannot be very strong because it would get into the people's mouth, and that's not good if it's too strong, right?
That's right, it's very mild.
And then you do a similar job in the office with bleaching trays, but them are like mouth guards, and you take an impression so they fit very well, and by doing so, the stuff you put in can be stronger because it doesn't come out, it doesn't disturb the person in the mouth, and by doing so, the person has to have it in it a lot less long in the mouth.
That's correct. Yes.
And then the third one is the bleaching on in the Zoom, which just takes an hour or so of an office visit. And not everybody can take it because sometimes it's too sensitive for the teeth because it's too strong. Is that what you say?
That's right.
Okay. Now, what about a person who has white teeth? Who got it bleached and now they are white. Can he be doing bleaching a half a year, 2 years when they get brown again? Because they will get brown, because most likely the reason he had brown teeth in the first place, most likely it's because he's drinking red wine, smoking, drinking coffee, and doing the things which make teeth stained. And he most likely will not change his style. We know that. So can he do it over and over again? Yes or no?
Bleaching can be do over again, but once the bleaching is done, and if you properly take care of your teeth, it lasts few years. So 2 years or 3 years, it can be last. Yes, but if you keep drinking coffee or wine or even smoking, then you need to bleaching more often.
Well, that's my point. People who drink coffee and wine, I mean, they don't give it up even though they already have a DUI. I'm just talking extreme cases. And, we don't stop eating our bread and pasta and whatever it is, whether we are overweight or not. And, you're not going to get me to stop drinking coffee simply because I like a good espresso. So one way or the other way, I assume people will not change their lifestyle. But if they don't, my point is, clinically, can they go and do another cleaning whenever they get brown again, whether that's in a half a year or in a year? Depends on their lifestyle. Okay.
It can be done again, yes.
Well, all right. Wonderful. Okay, well, let me ask you another question. When you bleach a tooth, so let's say the people who go to to a pharmacy and they buy a home kit, what about if they have teeth which have certain fillings, or I had a root canal done, or all kinds of little things, and they bleach it? Would that work, or would all of a sudden, because of the background that, let's just say the filling now didn't bleach and the rest bleach it, and all of a sudden they have white teeth with some other funny spots in it? Is that possible?
Bleaching is only for the natural tooth. If the tooth has kind of filling or crown, it cannot be bleached. So bleaching works only for the natural teeth. So when you have the bleaching, you have to think about how can match the tooth color. So you have to consult with the dentist for the matching color.
So basically, what you're saying is, let's just say I have one veneer, because I had a chipped tooth, you put one veneer on it, you matched it to my teeth at the time you put it on, and now, 5 years later, I have brown teeth. And I go into bleaching. The teeth will get white except the one you put on 5 years ago. It will stay what it was, right?
Yes.
So that's not good. And if I had certain fillings and other thing, also not. So it's probably better, I assume, for any person, even if he wants to go for a kit in the store, to first go check with the dentist, because the dentist might tell him, look, you have something here, you're going to come up like a camouflage type of something. It's not going to look good, and we need to do something else.
That's right. So you have to consult with the dentist before you start your bleaching.
All right. Good. Thank you very much, Dr. Kahng. Very informative again.
Thank you.